past 4 decades, we have been witnessing an evolution from alternative medicine, which denotes the antagonism between conventional and complementary, moving towards the more pluralistic gesture of complementary medicine, which still lacks the much important communication between conventional and complementary. And now we are moving into the era of integrative medicine, where the sum is bigger than its parts. Integrative medicine is being defined pretty well in the outpatient settings, but few is known about what happens in hospitals. Is there a place for integrative medicine in hospitals at all? We think integrating in hospitals is highly justified. It's highly justified because of the morals that moved us into this profession, like letting the patients choose their health, doing no harm, and benefiting patients. As an example, if a young patient undergoes inguinal hernia surgery and experiences urinary retention following surgery, wouldn't he choose to have acupuncture to relieve his urinary retention instead of having the potential side effects of having and unpleasantness of having a urinary catheter indwelled in his meatus? So for these reasons, something great is happening in Israel. And this is a selfie that was taken from the spaceship Bereshit, the first selfie. And the ground crew on the base noticed 2 things. One is that we are a small country with big dreams. And the other one is when you zoom in into planet Earth, that a new integrative horizon is opening in Bnai Zion Medical Center on beautiful Mount Carmel. We started 9 years ago, exactly 9 years ago, in the general surgery department, and then throughout the years, you see how we expanded into the different departments. It was because of the success in each department that the directors of the new departments wanted us in. And I'm going to share with you just the experiences in our department, how it works, how we integrate daily complementary medicine with conventional care for inpatients, for hospitalized people. We provide acupuncture, reflexology, hypnosis, guided imagery, Tai Chi, and Qigong for hospitalized patients free of charge. Typically, we let the surgeons do their virtuous stuff in the surgery room, but then the pre-care and aftercare of patients is less of their focus, and we do great work there. We focus mainly on supportive care, on symptoms, treating pain, nausea, vomiting, preoperative anxiety, and we do very well. We are with the patients in all their surgery stations, from the outpatient clinic until their discharge, emphasizing different care for each situation they experience. As an example, this is Rachel, who is the head nurse in the pre-surgery clinic, and she provides informed consent to a patient who is going to undergo surgery in 2 or 3 weeks from now, and she tells him about the integrative services. You can prepare your body and mind with hypnosis, either individualized hypnosis with Dr. Tzachi Arnon, or you can prepare yourself with generic guided imagery CDs on the website of the hospital in Hebrew, Russian, and Arabic. Your eyes are probably on the left upper side. This is really history because something interesting is happening in the picture. You acupuncturists probably notice. Okay, this is cardiac catheterization, we're doing angiography, and the needle is inserted in the patient to relieve his anxiety and pain and the vasoconstriction from the catheter inserted into his artery. Isn't that exceptional? We have reduced so much the use of morphine and anxiolytics just with using simple acupuncture in the angio suite. And this is how it works every day, okay, with the patient. This is Shmuel Atias. He's a reflexology and mind-body therapist. We treat patients in their rooms, in their beds, with complementary medicine. We don't have fancy, distant clinics with New Age music and incense. We should be near the patients. Otherwise, integration will not happen. And this is a very important leverage point for integration. Can you imagine most of the patients, when they are hospitalized, they are passive. They are dehumanized. We tell them what to wear, when to eat, where to go, and suddenly, every day at 11 a.m., in the central space of the department, patients practice Tai Chi. And families come in, you don't see them in the picture, but families come in, physicians come in, nurses come in, and they all partake in this experiment, in this experience. Think of the transformative experience of physicians being role models of promoting health and patients partaking in their own health. This is revolutionary. But if we want to create a revolution in the hospital, it's not only the patients. The patients are the main focus. But to create integration, you need to leverage it into the other sectors of the hospital. We need to invest in the hospital staff. And this is an example of weekly Tai Chi for the laboratory technicians. They will never miss it. Think of the impact. And yes, staff well-being is highly important because when the staff experience, when the nurses and when the physicians experience what acupuncture is, what reflexology is, they will know what the experience is and they will recommend the treatments for the patients. The most important factor is not an analytic mind understanding the scientific impact. Okay, the number needed to treat of acupuncture for carpal tunnel syndrome. It's really the experience of the people. That's how we work. So gradually, what happened over the 9 years is that the cogwheel of the complementary medicine service started to reshape the way our institution, Bnai Zion Medical Center, thinks about integrative medicine. And that happens because we invest in teaching the medical and paramedical staff what complementary medicine is. They invite consultations for complementary medicine through the hospital IT system. Everything is visible. The hepatology consultant is invited to consult in the same way as the acupuncture practitioner. We provide wellness workshops for nurses and other staff. We changed the concept of the stretcher-bearer team, which carry the patients across the hospital, in that we taught them positive suggestions. When the patient is naked under the cover and taken in the hospital from one department to the other, think of the anxiety looking at the ceiling, okay? And the stretcher-bearer teams provides now positive suggestions based on hypnosis and guided imagery just to relax the patient. Such efficiency of time. And the surgeons were amazed to see how hypnosis can improve the way they work on a laparoscopic simulator, and they can improve the time and proficiency where they conduct a peg transfer, which it's a way they prepare to surgery. Hypnosis. Okay, we made them understand it's beneficial for them. We came to a point where the hospital administration put the slogan of there is no medicine without complementary medicine. There is no medicine without complementary medicine, the administration of Bnai Zion Medical Center says. This is a huge integrative milestone. And much more is going on. Okay, we teach medical students about complementary medicine. We teach complementary medicine students about integrating in hospitals. We conduct economic analysis on the impact of integration. We do a lot of stuff. And why do we do it? Because we believe that the movement we created will move the cogwheel of the entire healthcare towards integration. But how can we make that effective? How will we conduct this revolution? And it always boils down to the human power, to the human resources, to the practitioners who are near the patient's bed. It's the practitioners who are the integrators, and we'll call them integrators from now on. And from day one, from the inception of our service, in every interview for a new employee, these are the characteristics we are looking for. We want them to be experienced before they enter our service, at least 5 years of experience. Why that? Because it's a jungle outside, full of practitioners. And if someone survived for 5 years, it talks about their determination. And it's also important because now they are seasoned acupuncturists, and when they come to patients, they know what to do. They will know what to do. We want them to have multiple specialties. We want them to have a large toolbox of treatment modalities. You never know what you will encounter. It's better to be a mind-body practitioner and an acupuncturist and a touch therapist, etc., in order to manage those hectic cases, which I'm going to present soon. They have to have outstanding communication skills because, as Steve said, there are guidelines out there, but no one knows to speak the language of complementary medicine. What is it at all? So they have to be very effective communicators. They have to be educators because they will need to teach about complementary medicine, both the patients and the staff and medical students and complementary medicine students who will come and learn from them. Yes, unpretentious. I want everybody in my department, also my physicians, of course, to be unpretentious, to be humble. But when you enter a new territory, territorialists are always terrified that you will take a bite. So they need to be humble and do their work, okay, not to proclaim they have panacea with complementary medicine. And they will work solo in the departments. That's why they have to be leaders. Eventually, they will face reality alone. Without being a leader, it will not be successful. So we have a group of brave and very serious leaders here, and I owe them the cogwheel movement that was created. I'm going now to talk with you about the integrators. What are their experiences in the 9 years of our operation? And the information that I'm going to share with you was through conducting a qualitative analysis of interviews with the practitioners at 1 month after starting their work at Bnai Zion. And then a year later, we have gained insight of what are the practitioner experiences in an integrative hospital. This was not done before. Before we do the integrative revolution, we need to do it effectively. We should limit the mistakes. Therefore, we should understand the experience of the practitioners. We need to make it smoother for them. So listen carefully. These are photos that were taken of an 82-year-old lady who experienced acute myocardial infarction, and she was hospitalized in the cardiology intensive care unit. These are sequential photos taken day after day. Has any one of you seen such complex and dynamic changes of qi? How would you treat her? So one of our past practitioners, Gur Kreindler, wrote a nice piece in Complementary Therapies and Integrative Medicine, an esteemed journal, a tongue's tale, to talk about his experiences that he encountered with this patient. And again, acupuncture is very effective for pain control. And sometimes I think, maybe it's a placebo effect because it's similar across all departments. Some 40, 45, 50% reduction in pain of postoperative pain. But in a subset of patients that experienced post-laparoscopic shoulder pain, after laparoscopic surgery, 20% of patients developed shoulder pain, which is not relieved by medications. And our practitioners started treating those patients with zero outcomes, totally ineffective with acupuncture. And that drove them crazy. And they started to research this approach, that approach, null. No success at all. Patients were still very painful. And then they started looking at the ancient texts. And that's why I call this back to Neijing. Usually when you're stumbling into a new situation, you don't know what to do, you always go back to ground zero and think, okay, let's analyze this qi phenomenon as the Neijing did. And they came up with the understanding that phlegm builds up so fast postoperatively that we have to treat acute phlegm syndromes in those patients experiencing post-laparoscopic shoulder pain. And it came out that adding PC5 to the treatment changed the whole game. And patients become relieved of their pain. Practitioners return to basics. In the hospital, there are extreme treatment limitations. It's not like in the community. And this is an example of Dani, who is going to take care of a patient in the angiography suite. Okay? So the patient has an arterial line inside his radial artery. How is he going to do pulse diagnosis? Legs are covered. Okay, they're going to be catheterized soon. Where is he going to insert the needles? Can you use moxa in this room? Electroacupuncture, maybe? That's a good idea. Moxa and electroacupuncture. They need, these people, these integrators, need to be highly creative in their work. We are, much of the time, symptom-based. And we relieve symptoms. We don't have the time to look at the whole person, bio, psycho, spiritual, social elements, the holistic frame, as we have time in the clinic. We have one short interaction, like with this young girl that is going to have surgery, and she is extremely anxious. How are we going to treat her? Symptomatically, okay? So this is a type of restraint that the practitioners report, okay? But they have become very good practitioners in taking care of symptoms. But we can look at preoperative anxiety in a little bit more sophisticated way. So we take a symptom, but we know that we have different constitutions of patients that experience preoperative anxiety. The intimidated, water element, just terrified of death, the experience of death and surgery. And the wood element, which is stagnated now from his anxiety, he's agitated, it is shouting on the staff, etc. We will have to treat them accordingly. So yes, symptoms, but in a sophisticated way, which is a little bit more holistic. And because patients are so complicated, it's not the patients who are complicated, the situation is complicated, we need to have diverse treatment tools in order to maintain all the symptoms and control. So they have to have diverse treatment options, Japanese, Yamamoto, whatever, okay? Just have a wide, large toolbox of treatments. And it's another thing is that we have integrative treatments within complementary medicine, meaning that we use a lot of mind-body therapies while we do acupuncture. We call it hypnopuncture. And think of the theory behind it. You put the needles in, and you've seen it multiple times in your clinic, 5, 7 minutes, patients are starting to blink, the breath becomes heavier, okay? And they enter into a meditative state. So you put the needles in, the Shen is already mobilized, why not add positive suggestions and move the way, create an even bigger way of healing? So all of our practitioners know how to do hypnopuncture. There's a nice joke about a Jew who has rescued himself from a shipwreck, and he's alone in an island. And after several years, some group comes to rescue him, and he gives, just before they go back to the ship, he gives a tour on the island to the rescuers. And then they go through 2 buildings, and the rescuer asks, what are these buildings? And so he says, okay, these are synagogues. Okay, why 2? To this one, I'm never going to pray. So just imagine, okay, stems and branches believers and 5-element believers coming to work at our center. Can they ever reach a consensus? How many synagogues should I open in Bnai Zion Medical Center? Okay, but when we approach a condition like post-laparoscopic shoulder pain, we need to work together as a team. We need to brainstorm, okay, in order to reach a consensus or some kind of approach. And that is even more important in research, because if I publish research about what is done in Bnai Zion, and that's just some idea coming out of a brain or a belief of one of the practitioners, it will not be generalized. There's no generalizability of the study, okay? So we work together when we have a new approach for patients. We usually use a Delphi method, and I'm not going to elaborate that, just to mention it, in order to create some systematic approach. And another way to do it is to look at the diagnostic system, validated diagnostic systems that are out there, such as Professor Wang's characteristics of constitutions, the 9 constitutions. It's easier to work when you work in a large system as in a hospital. Not everything was paradise when we started our service. And there was a huge inferiority complex by the practitioners. They felt that they are low in the hierarchy of the hospital because they didn't know their role exactly, okay? They have no shingles to expose, not a PhD, MD, etc. So they felt somewhat inferior. But over time, when the staff and patients, through the patients, recognized their work, partnerships were established and recognition was given. And that's not a matter anymore. Actually, on the contrary, our staff now want complementary medicine in every thing they do, research, clinical work. And this is an example of academic work where we teach medical students how to conduct physical exams based on touch concepts from shiatsu. The physical exam is much better, I can tell you, and the patient experience and the physician experience. So things have changed. How many of you have seen a person dead or dying? How often have you seen that? Once or twice in your lifetime? Sagi Gavrieli is an acupuncturist in my department, okay, and he experiences patients' death on a weekly basis. And when I asked him to treat patients who are dying, you know, maybe a matter of minutes or hours, I asked him, can you promote with acupuncture the process of healthy dying? Healthy dying? What is it? Can we assist in gently separating yang from yin? And what impact will that have on the practitioners on the long run, experiencing that time and again? Of course it has an impact, but it's our role as a service to embrace those practitioners in their journey and assist in creating a state of post-traumatic growth. Hospital environment is very different. To your clinic, patients select to go. Okay, they believe in complementary medicine. Many of the people who enter hospitals have not heard about complementary medicine at all. You know what? 10 to 15%, and that's a study we conducted, 10 to 15% refuse to receive complementary medicine. Our practitioners need to know that. You need to know that. And we need to establish a way to communicate complementary medicine, to understand the barriers and create facilitators of integration. Yeah, and integration. Immunizations. Can you imagine, you know that it's part of the health system in Israel that staff needs to take flu injections every year, okay? So it'll be less infecting patients. Can you imagine an acupuncture practitioner who is willing to insert actively into his body an evil pathogen? That's an example of, does integration go both ways? We want to be integrated in the conventional system, but how far are we willing to go to integrate the conventional system into ourselves? Think about it. And part of being a worker in a hospital is to work with accreditation rules, okay? We are ADD, OCD, we are very active, we are alternative. But in a hospital, it's a hierarchical system. Okay, we need to work by rules. We need to create quality assurance, treatment protocols, safety measures. Wow, okay? You have to have a little bit of a different personality to engage in that, especially, okay, in safety, because primum non nocere, okay? You cannot hurt the patient, and therefore we must be very cautious in what we will do. Okay, one mistake for the complementary team in the hospital, and everybody will talk about it, I can assure you. Okay, so we created a safety guideline in our hospital and published this a year ago, because are we allowed to puncture a patient after acute myocardial infarction who is fully anticoagulated now with heparin? Is it safe to puncture a child with leukemia with less than 20,000 platelet count? or a woman after axillary lymph node dissection, or a woman with axillary lymph node dissection, can we insert needles in that arm? Okay? So these are questions, and the guidelines, I think, are appropriate also for the community setting. Research is highly important. Okay, in our framework from day one, we knew that we have to put the mirror at the end of the day and see what we do effectively and what we need to improve in. So the setting was initially a prospective pragmatic trial of standard of care plus complementary medicine versus standard of care alone. And as an example, you know, preoperative anxiety, okay, patients are anxious, so what? Okay, they will live through it. But preoperative anxiety is correlated with perioperative morbidity and even in mortality. So we must address a serious symptom that we must take care of. And when you look at the red line here, which is standard of care only, what is standard of care? Take anxiolytics, benzodiazepines. They are not effective because most patients experience around a 5 out of, in a scale of 0 to 10, 10 is the worst anxiety, 0 is no anxiety, they enter the surgery room around 5. That's moderate to severe anxiety. And when you add complementary medicine treatments, you relieve the patients. They get relaxed into the surgery. We believe it impacts their outcomes, and we have shown that too. But is that the right way to look at research in terms of traditional Chinese medicine? Because when we see that nausea is relieved by almost 30–40% with acupuncture, how would a Chinese TCM practitioner look at that? Well, he would look at it totally different. Because we have at least 6 syndromes, and every syndrome will respond differently to acupuncture. So the question, the research question should be which type of TCM syndrome that is associated with postoperative nausea is relieved by acupuncture. And that's contextual research. And contextual research has many facets in it because we want the practitioners, we want ourselves as researchers to provide acupuncture in the context of TCM philosophy, not cookbook acupuncture. However, we want to keep ourselves, although we want to be individualistic and TCM-oriented, we want to be systematic, as I described before. That's how you do it through Delphi processes, and you need to document precisely, okay? Because the next practitioner who will come in Australia to follow up with your study, he needs to know exactly what you did, and there are stricter guidelines to do it. We need to correlate the outcomes into the syndromes or constitutions, as I showed you before with postoperative nausea. Initially, we started with pragmatic trials. That was the framework for research. But in the past 3 years, we are focusing on more boutique research, more complex methodological, randomized blind and controlled trials in acupuncture. And that's because we're fed up with publishing in the ghetto journals of complementary medicine. We want to get out and publish our work in high-impact scientific subspecialty journals of conventional medicine. And this bottom line, for the sake of time, I will just move to the next slide. So what are the take-home messages from my presentation? By now, I am sure all of you understand very well that hospitals are a leverage point for integration. They are an Archimedean point for integration. Therefore, we need to shift the system towards that. Complementary medicine colleges should teach their students towards working in hospitals. They should have internships for students or seasoned practitioners in hospitals. You must have safety protocols in place before you work in hospitals. And you cannot send a practitioner, even though they are leaders, okay, they are humble, they are creative, etc. You have to have a preparatory time for acupuncturists before they start working solo in the department. And even when they work solo in the department, you saw how complex it is. We have to have an eye open because it's a system. We have to invest in win-win situations with the staff, either wellness workshops, okay, or research agendas in order to establish this integration. And we have to do it with visibility through the hospital IT system, be there in the grand rounds, be there on the spot with the patients, with the team, hand in hand. And we have to conduct research to know what is genuine, what is true at the end of the day, what works and what doesn't. And the team is a wonderful team, but the environment of the hospital is very intense, is very stressful. Everybody needs nourishment, but our practitioners need it, I think, more than others. So we need to invest both in their professionalism and in their humanism. And all the time, look for new venues for integration, because it never ends. Becoming integrative as a person is a lifetime endeavor. All the more so, integrating a system. And in my correspondence with you, Yair, at the end of your emails, you sign with Kawai Kanjiro, which means we don't work alone. We have a lot of work ahead of us to bring integration into the health system. But the good news is we don't work alone anymore. Thank you very much.